Political leader of the National Democratic Congress, Nazim Burke, says the healthcare sector of Grenada is currently a broken system which needs to be fixed. While speaking with radio host Brenda Baptiste on GBN's morning radio program, To the Point, the political leader says the lacking healthcare sector must be placed as a priority.
As a country, we must see it as important for the country, because if you have a sick population, you're not going to have a productive society. Health is wealth, and we must see this. We must see our health as a strategic asset that must be developed, nurtured, harnessed as any other. So it means that the state has to invest resources in making sure that the population is happy. It's healthy, I'm sorry. And right now, I think we have a broken system. There's no secret about that. There's a terrible shortage of doctors, terrible shortage of nurses. The waiting time in the emergency centers are really, really very bad, very long, and very difficult for people who go in anxiety and distress, hoping to see a doctor. The situation with basic medicines and medical supplies is not good at all. And tests, Brenda, diagnostic tests, I think is perhaps the most troubling area. That something happens, the doctors say, well, listen, you've come in, we need to know what is happening to know how to treat you. They need blood tests.
He says there are a number of challenges which is being faced by Grenadians, especially in the instance where a family member is sick and needs urgent medical attention.
You know, one of the problems that you see in addition to that, and which is very distressing, is when people have some catastrophic illness in the family. Your daughter or your son, God forbid, is discovered to have a brain tumor, right? You have to find $7,000-8,000 US to send them abroad in Trinidad or somewhere. You don't have the money. Yes, there's no fund that you can turn to. And families, you see it all the time, families have to go on trucks, organize raffles with public address systems, asking the people to give something. There's nothing wrong in asking, and there's nothing wrong in giving. Don't misunderstand me, please. But what I'm saying is, there has to be a situation where the population feel more assured about their health.
Government should create a national pool to fund the health sector of the island, he says.
So the government has to create a health fund within the context of a national health insurance scheme. We have said before, that fund can be funded and must be funded. I raised on GBN the other night when I came to be on the Headlines program. We now have a National Lottery Authorities Act. That law basically says that the monies that are generated there will be used for sports and culture. It does not say nation building, but there's a tagline that says sports, culture, nation building. And we are saying, listen, if health is so important, we are not saying sports is not important or culture is not important. If health is so important, let's give health the same status. Okay. Let us amend the law to say that health and the funding of health must be a necessary outcome of the monies that are raised in the lottery. Right. Yes, we would like to see that happen, and we will do that if we form the government.
He added that funds raised from alcohol and tobacco sales can be used towards health development. Amandel Sampson, GBN News.